All right. Good afternoon, everyone. Well, actually, still we are in the morning. I've really enjoyed so far the conversations and presentations. I'm going to add a little bit from probably a little bit different perspective that is coming from my background working on disaster and emergency management in the past 30 years or so. And with the fact that early warning system has been one of the major key issues in larger disaster and emergency management context for the past almost 40 years. I want to give you a brief sort of coverage of what has been happening globally in this area, mainly early warning systems as it comes to disasters, and also provide and talk a little bit about one of the major bottlenecks here, to my perspective, that is basically economic valuation of early warning systems. And that is a field that this has been, as I said, one of the major topic of my research in the past 30 years or so, as I finished my PhD back in 1996. One of the key questions that I had was about how much is the value of all these disaster mitigation, hazard mitigation, warning system at all, if there's any. But this is a big question, especially when it comes to decision making. All we do in terms of research, science, developing technology, at the end of the day, reaches that bottleneck of decision making about how much is the value of these technology, methodology, or data or information that you are providing to us. How certain you are about that. So this was the main question. As someone with background in economics and someone also doing research in disaster field, I was trying to do. So most of my research, or at least the major part of my research, has been on that line, covering all types of mitigation measures related to disasters, from shelter, from warning systems, etc. And I'm going to give you the conclusion first. That is, we are still at the beginning of this problem. We have not solved this problem. To my understanding, it is mostly about the actual human and policy making processes. They are almost the same as they were when I finished my study. Nothing really has changed major. So this problem, to some extent, still exists as it existed in 1996 or so. While we know that technology has changed, a lot has changed actually. We have done a lot of effort in this area, but that bottleneck I'm talking about is still remaining. Now, and this is basically it. And when we are talking about early warning systems, we really talk about a large number of them that are, if we just focus on disaster and major hazards, they cover at least, I would say, 50 types of hazards. If we just remain in a very broad classification of hazards that may cause major disasters. And they are all having different levels, jurisdictional, geographical, and also decision making levels that makes it even more complicated. So these early warning systems or warning systems not only are huge, but also in terms of numbers, but also competing with each others. And based on the experience, when someone has happened in the past, whenever you see a major disaster happening, this is being a little bit open in terms of some of those relevant early warning system being considered or paid attention to. And so we see some sort of relaxation in terms of policy making and selection of those. just like we had, for example, after the tsunami. There were lots of efforts, attention, and investment in early warning system related to tsunami because of that major event. And probably now we are in post or still in COVID situation, which obviously the fact that we are talking about it right now is to a huge extent as a result of this, this event itself. So had this not happened, probably not major change really in this regard. So usually this is being relaxed a little bit after some of the relevant events. Now, I want to shift the focus into the fact that attention globally to early warning systems, especially to disaster and emergency management or the natural hazard, basically, has a history now. Started probably early or around 1989 when the UN issued this International Decade for Natural Disaster Reduction. As part of that, there were several conferences. Actually, one of the major conferences happened in Yokohama when in 1994, and I participated in that, and I have continued to attend many of these major events since then. And the discussions around early warning, and as a conference, as discussion started in that mid-90s, and over time, many major UN conferences organized around this particular topic, especially those sponsored by government of Germany in different years. The focus was on early warning systems, and it was before the tsunami. And after tsunami happened, I mean, there was lots of shift to developing this tsunami early warning systems, and UN developed a number of actions and plans for that. But major, I think, actions, global actions, probably started after 2015 with the Sendai framework for disaster risk reduction. I'm going to cover a little bit on that. And continues till now with an action program developed by UN and is going to be implemented in the next 5 years to hopefully make some major enhancements in global early warning systems. Now, when I say global early warning systems, most of these are covering natural hazards except diseases, or if they have diseases, they are not as integrated as much as we think. Although my suggestion and my own thinking is that these two have to be integrated, not separated as it is right now. Now, these are some of the snapshot of some of these major events that I said. I've been participating in many of them. I remember I made a presentation in early warning conference on 2006 in Bonn, and that was when President Clinton at the time was the UN lead for tsunami response, participated and made the presentation there. There was an interesting story because the conference basically delayed for several hours because of the security related to bringing him inside the conference room. But I just want to say that there has been lots of ongoing discussions globally, and just last May in Bali, where there was this platform, UN platform on disaster risk reduction. And as part of that, we have this early warning system conference that most countries attend and make agreements around early warning systems. So there's really interesting story behind that. There are two pieces of particular interest that makes this global effort sort of commitment by different agencies and government around the globe. And one of them you may have heard and probably seen it before is Sendai Framework for Disaster Risk Reduction. This is from 2015 to 2030, which is basically lays the set for and stage for global actions related to disaster risk reduction. Target G of these framework has focuses basically on early warning systems, and this shows how important it is. Out of several targets that we are globally looking at, one of them is to make sure that we establish and provide early warning systems that are accessible to basically everyone. That has been the target since 2015. Have we achieved this? I believe probably not as much as we wanted, and that's why now you'll see the UN Secretary General is pushing for an action plan to make sure at least some of those targets related to early warning systems are achieved by 2030. We are behind in many areas, but this was also one of those. I hope with these actions, probably we get somewhere closer to the targets. Another piece of global initiatives that also covers early warning system to some extent are, of course, you have heard about Sustainable Development Goals. There are 17. Although you can relate early warning systems to many of these, but in particular, Goal 3 and Goal 11 that are covering mostly public health diseases as well as disaster and emergency management concepts and plans, they refer basically to early warning systems. And as important elements of them are early warning systems. So putting these are the two driving global sort of agreements or agendas that I think cover a lot of early warning system efforts globally. Now, there was a study, and this is also done by some of the UN-affiliated agencies, to examine what is the current situation in early warning systems globally. And this map is one of those, the results of one of those surveys, which is mostly based on self-reporting of countries about their early warning system efforts. And as you can see, there are, of course, a lot of countries that still do not have, or at least they say they don't report any or existence of any early warning system. However, even those who report that they have, it doesn't mean that they have an effective early warning system or comprehensive early warning system. But the fact is, based on at least this data, self-reported data, you can see an increase since 2015 to establishing early warning system in countries. Now, for example, from 47 in 2015 to 95. But as I said, these are really basically self-reporting. You need to assess that and evaluate to make sure that this really exists and is effective. This also shows sort of snapshot of what is happening in terms of alert systems. That is one of the components of early warning systems. Countries that have access and provided this to their population. It's an interesting figure, at least shows this capacity exists for the most part, above or close to 50% and up. In all different continents, including Africa. This is actually the report that I was mentioning. This report has been trying to summarize what is the current situation. And one of the slides that is very interesting and it shows is the fact that if you compare existence of early warning systems with regard to mortality rate in different countries. I mean, this is not, of course, statistically, just shows a picture of this relationship. You need to, of course, dig into some more robust relationship. But this just shows a picture. If you look at countries that have coverage versus countries that do not have coverage, the rate of mortality is quite high. We know that this is related to many other factors, but at least you see that countries that have developed early warning system have also different mortality rates as well. This plan that I was talking about refers to a plan that is designed to cover 2023 to 2027, and this is a talk by UN Secretary General at the time to basically initiate this plan. And one point here is that, of course, apart from all this technology enhancement, what is needed is more investment. And when we go to the investment point, we are really talking about economic values. And that is where my questions about what are the economic values and how we measure them come to effect. And actually the slide, the image I have in the left, just to say that this is an ongoing discussion. This was on UN LinkedIn page announcement yesterday. As I was preparing my slides, I noticed this one. So this is really highlighted in one of the key areas of UN ISDR. But obviously, as I said, when we claim that we have early warning system is something, but when we go into assessing whether it is effective or not is something different. This is an example of one of those early warning systems that are relatively established. This is for cyclone, for example, and this shows how effective they are, and those that you can see here with kind of brown color shows those countries that have, but not necessarily effective. So only country that you see here is South Africa and in part in Cameroon that shows they have early warning system that is effective. So generally speaking, this gives just a hint that having is something, but having something effective is different. And this is one of the probably most established early warning systems anyways. Really, if you look at the numbers that are asked for creating some of these multi-hazard early warning systems, you will notice that these are not really expensive. This is what is being asked. The total number is 3.1 billion for global multi-hazard early warning system. That is, if the UN wants to implement this warning system, and compared and relative to all we spend, all countries in military, in other areas, this is really nothing. I mean, this is probably a very small piece of those kind of expenditures. But individually, countries have still difficulty in convincing that this is needed. This has a lot of value, and so on. You have seen, and I think also discussed here in this workshop during the yesterday talk and also today, examples of early warning system. This is, for example, another one, but this is mostly on food security. A lot of these are being developed and exist. I just want to make sure that all of us actually hopefully someone or somewhere we have a repository of, or at least a website somewhere that shows all these efforts. I think there are a lot of them here and there, but there is no one platform that shows all of them in one screen so that you can see. But there are lots of them, and that may also talk about some of these expenditures that we have. We are not necessarily doing efficient way of creating and developing this early warning system. Everybody is doing something on their own, not knowing necessarily about each other's work and so on. So it's probably time to come and bring all these efforts together, make sure that we are all using our resources efficiently and wisely. Let me check my time. I know I have to finish anyways. I shouldn't punish you for late start. This is a case. I think this was discussed also yesterday. But remember, we had this one of these I think global pioneering disease network disease warning system started in 1997 in Canada, and it could have grown and become really a lead in early warning system. But we end up with the same bottleneck I was talking about. Over time, you know, this established, worked, received very well globally, but at some point, government did not put enough resources to continue this. Because, you know, essentially not major event happened. And of course, when COVID started, we end up, you know, thinking why this was not properly resourced. When you're talking about early warning system, you have to think about long term. This is a long-term investment. It is not a 1 day, 1 year, 2 years, or 10 years investment. It is a long-term investment. You may get the benefit of it, you know, through this 100 years. So you invest for something like that, and so you stop after a while. This doesn't really make sense, and you see that there were lots of you know. Media attention to that, and this is the report that you can go and read it yourself. Basically explains the fact that the resource was an issue. But if you go to numbers again, if you add up all these expenses that, for example, government of Canada has spent all these years for this, it adds up probably to 50 million or so. I mean, if we continue the same trend, is going to be $2-3 million every year if you want to have continue, and even if you want to enhance it, there's not going to be a huge amount of money compared to the value that it has. But you know, it didn't go that way, unfortunately, at the time, and now we are realizing that we need to invest and continue doing this based on, I mean, learning from COVID. Now, I come to this point, I think it was mentioned by all of our speakers, by Sven in the morning yesterday, and all other friends and colleagues, that apart from technical aspects, we have some human, important human elements that I call them three willingness. One is, of course, willingness to pay. That is one of the key issues here that I'm focusing on in my research. Willingness to listen. So even if we provide and convince that this is the value of this early warning systems, and or this is going to be effective, does this it doesn't necessarily mean that people or policymakers necessarily listen to you. And so this is the next step, or the next bottleneck, if you want. And of course, willingness to act was a focus of our previous speaker, Kamran, and that's again an issue. Whether despite spending money, even government and policymaker listening to that, at the end of the day, people need to act to this, you know, warnings and information, etc. And all of these have problems, really, to be honest. And that is what I was saying, that despite like 40 years of research, at least in this area that I'm doing, not much has really change because we are all human. The same were people before us, and the same probably people will be after us. However, we should, of course, say that this education, training, proper understanding of these systems, and addressing some of the challenges of these systems may indeed impact this and make changes here. Now, sorry, you just warned me about how much time I have. I'm looking at the slide because my slides are not changing here. Some of the cost of early warning systems, basically, or the cost and benefit. So this is one of the key when it comes to making decisions about that. And that's why there has been attention to this also within the early warning system activities and research and policy making process. This GARE report is kind of reports UN prepares as part of disaster risk reduction platform every couple of years or so that covers issues around global disaster risk, and much of this is about the costs and benefits of early warning system. And this cost, of course, covers a number of items. For example, cost, and also the benefits. And if you go into details of each of these elements, you will see these are really, really complicated items. It is not easy to calculate the benefits of some of these measures because of the uncertainty that exists there, because of the different interpretation, for example, of the value of life for different groups, different countries, and even the different methodologies. So it's just want to emphasize the benefit part, or calculation the benefit, but calculating the benefits are not easy. The cost may be easier relatively because we know how much we need to spend, but the benefits are not as easy. And that's why economists and people have started to develop methodologies that are able to extract the benefits or measure the benefits or value of these measures. It's not really enough to say is going to save lives. It is not enough to say it's going to bring this or reduce this amount of losses that we will have. You have to be as certain as possible and as accurate as possible. And that is, as I said, this is not an easy thing to do. But policymakers at the end of the day want to evaluate the benefits versus the cost, or the overall cost-benefit ratio to make a decision, not only about whether this particular early warning system is effective or efficient, but also compare it with all other costs and programs, projects, plans that they have. And you believe it, sometimes it is a matter of deciding whether I need an early warning system that looks nice, but or I want to, for example, build this bridge, or I want to build this, for example, the hospital. So in that decision, it's not really easy to switch the resources that you have easily. Now, these are some of the studies that have been done in the past, and in all of them, and it's not surprising that we get to see that actually the benefits of all these early warning systems or measures are above their costs. Often, in 10 times or more the cost. You can see, studies of different types of early warning system, or the value and cost of early warning system, as well as in different countries, different scales. Overall, you can see that really the value is much more than the cost. Still, we have the difficulty of convincing and implementing some of these measures, because again, as I said, this is related to all other decision-making processes that make it difficult. But rationally, if you look at these numbers, you say, okay, well, I should spend in this with this number. This is an interesting study. An example of earthquake, for example, and you see that. Just want to emphasize that these studies are being done and trying to measure. This study is, of course, at the regional level, for example, trying to assess the value of an early warning system for state in US, and this study covers almost 50 years, I believe. And so they have come, for example, with $289 million of the value of this early warning system. Now, you, of course, have the cost in front of you, and you have you can then make a decision whether this is something you want to invest or not. And you obviously see that behind the scene, there are lots of uncertainties, for example, whether this earthquake is going to happen or not, whether the cost that we are talking about, the building damage, human casualties, etc., are going to actually happen. So these are all based on probabilities, based on estimates, etc. But then at least you have some measurement for comparison and decision making, especially at public level. That is going hard. Now, a bit very quickly on why it is hard for policymakers to invest in early warning system. I covered and talked about some of these before, but essentially what you can see is that some of these values that we are talking about are sort of not visible or tangible. This is not compared to any other projects that these policymakers make decisions based on are really tangible, especially the benefits that we are talking about. And most of these early warning systems, these are requiring continuous maintenance and support. So it is not one-time short-term investment. So you need to have commitment from several levels of government continuously to support them. If there is a policymaker or an elected official pay attention to this, invest in it, you need to make sure that this is being taken care of by the next elected official after that. So this is not always happening. And you also have other conditions, because early warning system is a multi-jurisdictional, multi-governmental level, and also multi-organizational type of effort. And these are difficult to make. Often you can see it in normal activities that we have. When you bring in lots of organizations, especially in disaster and emergency management, we always experience bringing different organizations to work together closely on these issues. This is not easy and easy task really and that's why they are easily ignored or left aside. And we talk about data. Fortunately, data is becoming less an issue, hopefully with all this technological enhancement. Now, I wanted to talk a little bit about this, and I really finish after this, although I have some more slides, to see how we, as economists, try to evaluate or assess the value of things like early warning systems. There are different methods. All these methods have been developed basically to measure the value of what we call it non-market goods. These are early warning systems. These are not sold in the market so that we can go and purchase them. As such, we have to extract their values through other methods. And these are some of the methods that I have used in the past in my studies, and researchers are using mostly to find the value of early warning systems, for example. And Over time, of course, they have been improved, and as I said, a lot of studies have been conducted, especially also around early warning systems using all these listed methods. Now, machine learning is becoming very popular also, although we are not talking about the data for early warning, but mostly about the data about the value of early warning systems and so on. If you are interested, of course, you can get a sense of what each of these are. I have created a short survey. Basically, if you want, you can try it. I have put some questions, easy questions. Each of them relate to one of those methodologies there. We don't have time to run them, but essentially, if you want to go into this link, I was hoping to do it as an experiment here. You see, we often put general public to some of these questions to extract the value that they place for early warning systems. Because at the end of the day, when you want to say, this is the value of early warning system for the people, you have to go back to the people and see how much people are willing to pay for those services through different mechanisms. And this is some of these questions are related to those methods that I mentioned. There are studies, obviously, before COVID and after COVID, but this is really, I want to mention it here. This was a type of a study along those methodologies that I mentioned, trying to understand the willingness to pay for early warning systems for disease, infectious disease. This happened before COVID in 2017 or 18. And this was the results. In total, for example, on average, in these countries, people are willing to pay 21.8 euros per month to get this system in place. Okay, this is people's willingness to pay. And I calculated this, the calculation you see there is basically for example, for UK. If we multiply the values for the country, I don't know if it is, UK is this value, multiply this value by, this is I think I've used the average here. Multiply these values by value of life, etc. You will end up, for example, with the total that is there. I'm sorry, the total that you see there. And when you even compare these very rough estimates of the value of this kind of early warning system, you'll see the value is quite high compared to the cost that you can imagine for this system. This study was repeated by the same people during the COVID. Then they found people are willing to now willing to spend 50% more to have this kind of early warning systems, which is kind of interesting to look at it, because they use the same methodology for the same countries, and they came up with this new results. Meaning that, I mean, although there has been some increase in people's interest and payment for the systems, it's not really hugely different, although 50% is quite large when you add this up to the whole population. So I think I'm going to stop basically here, but my conclusion is this basically. And my recommendation to all my colleagues who are doing early warning system models, methods, and systems is that we need to embed the value of this early warning system in our system or in the system that we develop, so that as you show to the policymakers, to decision makers, to whoever, your numbers of whatever you predict or you say, you also have the numbers of, this is the number of lives we will be saving, this is the amount of other property values that we are saving right by making this decision now. otherwise, we get into the same bottleneck that we are talking about. And with that, I conclude, and I appreciate giving me extra time to finish this, despite I know this is lunchtime for all of you, and I appreciate that. Thank you very much.
Thank you so much. So maybe we'll have time for one or two questions.
So my question is, can we see early warning systems, some sort of insurance, but for entire communities or countries instead of people? Like we have different packages in insurance, and people can choose what do they want, and the poorest people cannot have money to pay for that insurance. And same case here. Thank you.
Mm-hmm. Well, you brought a very interesting dimension to this, that is looking this through an insurance. This can be done this way, and we have done it in the past. As in your valuation, you, instead of, for example, saying this type of early warning system is in place, how much you are willing to pay for it, you frame it as there is an insurance like this that you can purchase, and this insurance does this for you. This is the same early warning insurance, exactly. I like this idea of framing it as an insurance, but this is not really what we want necessarily, because we are trying to establish early warning systems that are accessible to all. That is the UN, at least point of view. For that, insurance is not necessarily a good option, because insurance already, we know not many people can afford to have insurance. By the way, the reason we make these valuations is not to say that those who can pay are going to be given this service. It is as a measure of knowing how much people value this product overall. It doesn't mean that we have to provide it only to those who want to pay. It is just as a measure for ourselves, for policy making, for finding the benefits that we take care of that. But I appreciate your question. Thank you.
Professor Asgary, thank you so much for bringing this conversation into this. We must leave this out. The cost is very vital, and I really want to thank you equally for looking at it, discussing the dimension of area awareness system for disaster management that you're already versed with. I think that we need to join forces with what we have been doing in other areas and say, how do we bring that knowledge? When we talk of the cost, and I will be happy if you relate this to the cost of disaster management that or disasters in the country. When you look at the cost of life in Canada and you average this throughout the pandemic, if we complain about the cost of early warning system, is it worth up to the cost of life, given how much Canada and the world value one life? And again, maybe you may want to relate this to how you define cost.
Sorry, I didn't get all of your words in your question. Can I ask Jude to repeat it again?
Thank you. I think the key word here would be on the cost of life. So when you talk of the cost of an early warning system, how do you relate that to the cost of life, given how much Canada defined the cost of one life?
Mm-hmm. Thank you very much. Yeah, very, very good question. I was playing with these numbers past days to figure out what are these numbers, and I created an app to show that. And actually, the slide I showed you for UK based on this study, I was trying to attach this value of life and find out the numbers in terms of what we lost during COVID is huge, just for human losses. If you multiply it even by statistical value of life, I have the numbers, it's not in my mind for Canada, but it is huge. It is not comparable with any cost of any of these measures that we are talking about. For example, even that 50 million that I talked about, the Canadian system, if we want to have it running, it is not comparable at all. But we need to we need to think that this is now. Unfortunately, as you noticed, before COVID, if it was before COVID, people are still were in the mindset of, who knows if something is going to happen. And now we know. And so making a decision based on what we know is not an issue. What is an issue is that you are talking about future that is not certain. We don't know what is the next type of disease, and making a decision based on what I was mentioning is of course importance. But we need to learn from these numbers and obviously make better choices now. I stop. Thank you. Sorry, I hope I have answered your question.
Thank you so much, everyone. So we will go to lunch and we will come back at 1:30 for the panel session and the discussion sessions. Thank you so much. Great talk.